Nnamdi is our next guest. Nnamdi actually has some experience of this. I don't know whether Nnamdi might want to go off script and address that first, but I'll introduce you, Nnamdi. Nnamdi's a mental health professional. He's worked in mental health units across London, as well as children and adolescent mental health services as well, and in schools as a therapist. Nnamdi, I was going to ask you about your particular experience and also specifically the stigma that still exists in Black and minority ethnic communities. I don't know whether you want to pick up on what Helen was talking about, but otherwise, yeah, do go ahead with what you're going to share with us tonight.
Yeah, I mean, first of all, I just want to just applaud all the contributors today. It's been amazing to hear and hear the stories. And this is what I do, 9 to 5. I've worked, yes, across across hospital wards. I've worked across community mental health services, so the crisis line, as a CBT therapist, as a practitioner. So listening to all the stories, I've heard and talked to somebody just like that, and it's really inspiring to see how they pull their way across. The sad thing for me, being from the Black and Asian minority communities, that there's very few of us who come forward to seek the help. So right now I work in children's mental health, and probably less than 10% of our referrals will come from the Black and Asian minority community. But when I worked in adult mental health in wards, most of our patients, most of the people in sections were Black and Asian men. And yeah, I can relate from the stigma point. You know, parents from Nigeria, West Africa, brought up in Liverpool, but there was a sense that mental health was seen as a taboo. It was seen as what has the family done wrong, and it will bring wider shame to the family if it's brought up. When I relocated to the UK, I understood how I was part of that, how I was part of not understanding the wider problem.
What things have you learned, Nnamdi, through your work, or in particular, I suppose, the tips that you share in your book around these type of topics?
Well, I think we talk about you know, sharing and reaching out for help. I think what I would hope, you know, those who are listening and families and partners would do is to not be afraid to ask the question, or to name it and say, look, you don't look well. You look like there's something going on with you. What's happening? I've got a number of friends who, they know me well, they may be on this, who know that when we talk, I cut straight through and say, okay, let's put the football aside, let's put the other stuff aside. What's going on? You look like, you know, you're tired, you look like this, what's going on? And I love talking, I love listening, and so it's you know, to me, having a job doing this is passionate. But I would just hope that you just be brave and be honest and be patient. But then also, if they don't want to find the help, an intervention. You know, we do that if people are struggling with drugs and alcohol, but we're slow to do that if we find people might be struggling with their mental health. So I would hope an intervention would be something that people can look to do.
We all need a Nnamdi in our life, don't we? Someone that just cuts through. Absolutely. Yeah, you nailed it, Nnamdi. Thank you so much for sharing. Kimone says here, I resonate with the taboo of mental health within the BAME community. So true, says Lola, so much stigma. Matt says, name it to tame it. Fabian is thanking you for sharing. Yeah, thank you very much, Nnamdi, for